So I understand that some people were having trouble hearing me. If you are one of those people and I start to wander away and you're having trouble, just wave at me and I'll try to get closer to the mic again. So I apologize if you couldn't hear. So I guess they weren't counting on such a short person, so I'm a little bit closer here. So one of the things that got me thinking about some of these issues was a question that was asked by a palliative care physician from Quebec City, Dr. Serge Deneau. And he said at our Montreal meeting 2 years ago, he said, is the reason that we are having this emphasis right now on assisted death, assisted suicide, and euthanasia because we are not teaching our learners in the healthcare professions how to accompany people in suffering? And is it that we are at the point where we're saying, okay, that people are saying, well, I can't stand this anymore, and we're not teaching them how to accompany people. And the idea in French, the accompanying actually means like our compassion, to suffer with someone, to be very close. The best way that I've heard it described is it's a radical presence with an individual, not just kind of coming along for the ride. And we need to think, oh, all right, so I haven't got the slides on. Do I need to unplug it and start again? No. Okay, good. So that's Serge Deneau, in case you want to know how to spell his name. And, wrong way. We need to think about our language and eliminate the word burden from our discussions. Patients already have that in their mind, and family members do, so we need to just maybe talk about stress or difficulties or other things, but not use that word. And I also refuse to call myself a provider. I know that's supposed to be a little more egalitarian, but I would rather call myself a healthcare worker or a professional or a physician or whatever, because my care is not a commodity that is for sale. You don't walk in and get your nails done and decide what color you want. I have training, and I have a code of ethics, and I consider my relationship much more covenantal with my patients, that I have a covenant with them that I will care for them while they need to be cared for, not that they tell me what they want and then I am saying, yes, yes, sir, yes, ma'am, I'm going to do that. And I really think that it's not in the patient's best interest when we replace what people call paternalism, where a trained professional tells an untrained individual what to do, with radical autonomy, where the untrained individual tells the trained professional what to do. I don't think the person is any better off with that. This saying, to cure sometimes, to treat often, and to comfort always, is attributed to Hippocrates, and we need to think about that as our basis of medicine. Also, I think it's time that we ask some pertinent questions. So is it ever possible to eliminate all existential suffering, for example? And is this even a good thing? What about all the positive results of striving and overcoming, both for individuals and the community? We understand that the striving and the overcoming is important in the athletic arena and work and school and all of these things. How is it that some existential striving is not maybe important in our growth in other aspects of our life as well? Also, what are the implications, we've talked about this, for people living with disabilities if society's goals change from mutual support and compassion to providing death as a solution to those experiencing any type of suffering? And then who decides what type of suffering qualifies? We talked a little bit about that already. So I talked about Hippocratic medicine, and we've done that one already. And this is just part of the Hippocratic Oath. There is a Hippocratic registry of physicians from around the world that we host actually here in Canada, and people can sign up there and affirm that. And as I've said before, our heritage of respect for life is like an old-growth forest. It's our metaphysical environment, that it's very easy to cut down an old-growth forest and very hard to get one back. You don't get it back for millennia, really. And it's the same thing with this cultural heritage that we have. If we destroy it, it will not be easy to get it back. The Hippocratic physicians actually did establish it, but it's taken millennia for it to come to maturity. And what kind of a legacy are we going to leave for our grandchildren if we destroy that metaphysical environment? We all understand that we have a responsibility to people who come after us for the pollution that we put out into our physical environment. What kind of pollution are we putting into our metaphysical environment, our philosophical environment, our societal environment, if we decide that killing is a good option? So, but how do we start this? This is actually a photograph of a sign out at UBC that they even lit up at night. And all it has on the whole blank thing is a little thing that says, "You are here," just down at the bottom, nothing else. And I think sometimes this was I went out and took a picture of it because I said, boy, this is a really good, a really good metaphor for how it feels sometimes and where are we going to go? How are we going to get there? There are some really good things that are happening. Dr. Chachanoff is a wonderful palliative care psychiatrist in Winnipeg, and he became interested in why people in the Netherlands were supporting euthanasia. And he kept hearing this, lack of dignity, lack of dignity. And so he started doing studies about what constituted dignity for people and what made people feel as if their life had worth and did not. And so he has done a lot of work, and his group has done a lot of work on what things can be done within a healthcare setting to strengthen and preserve dignity. And it's very interesting. He's written a lot of papers about this. And then there are also other studies that are done about resilience for patients and for physicians, and how do we enhance these factors that help with resilience. And there's also meaning-centered therapy, helping people to figure out what was the meaning of their lives. And it's not telling them that. It's helping them to look at their lives and to think about what brought meaning into their lives. And one of the things that Dr. Chachanoff has developed is something that he calls dignity therapy. And I have done the almost 3-day workshop on that. And it's very interesting. There's questions that are asked of the patients, and they ask in it a narrative, and then it's all recorded, and someone types it up and edits it, and then it's read back to the patient to be sure that it's correct. And there are questions that are such as, when in your life did you feel most alive? What roles have you played in your life, and which ones were you most proud of? Do you have any words that you'd like to say to your loved ones? Things like that. And they don't include anything that's negative. If the person wants to say those things, fine, but as part of the dignity therapy, they don't include those things because they want this to be a positive legacy that the person is leaving behind. And it's absolutely amazing the positive effect that this has. I actually think that something like this should be available for every patient in a nursing home. And there was a presentation at the Montreal conference this time by a group from, I think it's from Australia, but I can't actually remember, who are working with dementia patients, doing this early on in the course of their disease, and then they're even using it with the dementia patients themselves. Once they get to the place where they can't remember these things, they themselves are having comfort from reading about what their life was like. So there are lots of things that can happen that way. Dr. Ira Byock has written this book, Dying Well, which is very interesting. It talks about, in pediatrics, we have these developmental stages. Like children have a developmental stage where they can actually learn to pick up something with a pincer grasp, and when they have object permanence, where if you cover it up, they know that it's still there. There's all these things that are developmental milestones. And Dr. Byock looked at people who were at the end of life and realized that there were some developmental stages there too. And oftentimes it's like peeling an onion, that people go through the developmental stage when they first find that they have an incurable illness, that they do the easy things like make a will, get their financial house in order, and they work peeling off these layers until they get down to the core of who they are. And one of the things he challenged us to do was to imagine our patients well, to think about them as if they are well, and talking about the difference between being healed and being cured. that Dr. Mount in Montreal is very fond of saying that you can die healed. And that is one of the goals of palliative care, is to bring healing into places even if you can't bring cure. And Dr. Bayok was saying that even people who are dying can live to the very last moment of their lives, and they don't have to be focused completely on dying all the time. And Dr. Cicely Saunders, who was the founder of the modern hospice movement, said, this was one of her famous quotations, "You matter because you are you, and you matter to the end of your life. We will do all we can, not only to help you die peacefully, but also to live until you die." And some of my most memorable moments as a physician have been times when I have helped people to do that. We had one patient who, this was back when I was practicing in Nova Scotia, who said to me one time, just in an offhand comment, that John Denver's music was what got her through her chemotherapy treatments. And she had a terrible head and neck cancer and was quite scarred on her face, and the cancer was spreading and eventually killed her. And it was a difficult pain situation to get under control, but we finally did. So I had this little bug in my ear, and I called John Denver. He was still alive at the time. I called his fan club, and I said, put me through to the highest person you can put me through to. And so that person, I said, put me through to the next highest person. Anyway, it finally worked out that John Denver gave 2 tickets to his concert and 2 backstage passes to this woman, and the closest one to Nova Scotia happened to be in Florida, and Air Canada provided 2 tickets for the patient and a nurse to go down, and we used some points that we had and got them a hotel room, and she got to meet John Denver, and she got to go to the concert sitting right in the front row, and she came back even in the situation that she was in and said that was the best day of her life. So that's a really wonderful thing to be able to do as a physician, and to see that people can still live, still have the best day of their life, even in that setting. Valfor Mount, who we talked about, I think one of his great contributions to medicine is reminding us that we're all on the journey together. And he said, our patients need to experience that we are with them as fellow travelers on this voyage. We must keep in mind that at best we are wounded healers. And I think all of us, that counts for all of us when we're in caregiving positions as well. I've been listening to the audiobook of Don Quixote, which is considered the greatest novel never read, and I actually couldn't get through it by reading it, but I've got a British guy who's reading it. I'm over halfway through now, listening to it, and he does all the voices, and it's really quite funny and quite good, but it took me, I tried 4 times with reading, and I do a lot of reading, but I could not get through that one. But this is great, and I've been writing down little quotations from there that were good, and this was right after Don Quixote had his teeth knocked out from doing something dumb, and Sancho said to him, "Oh, well, I'm really sorry," and he says, well, Don Quixote says, "For it is still some comfort in misfortune to find one who can feel for it." So I think that's important. How many of you knew that Louisa May Alcott was a nurse in the Civil War in the United States? Okay, she wrote some diaries. There were some things that she wrote about her experiences there, and I think she sums it up very well in this little section here. The next night, as I went my rounds with Dr. P, I happened to ask which man in the room probably suffered most, and to my great surprise, he glanced at John. He won't last more than a day or 2 at furthest. You'd better tell him so before long. Women have a way of doing such things comfortably, so I leave it to you. Typical doctor to the nurse, right? It was an easy thing for Dr. P to say, tell him he must die, but a cruelly hard thing to do. A few minutes later, I saw John sitting erect with no one to support him while the surgeon dressed his back. He looked lonely and forsaken just then as he sat with bent head, hands folded on his knee, and no outward sign of suffering, till looking nearer, I saw great tears, that should be roll down and drop upon the floor. My heart opened wide, and I took him in, as gathering the bent head in my arms, as freely as if he had been a little child, I said, "Let me help you bear it, John." So he was probably dying because they had no antibiotics, right, at that point. Never on any human countenance have I seen so swift and beautiful a look of gratitude, surprise, and comfort as that which answered me more eloquently than the whispered, "Thank you, ma'am. This is right good. This is what I wanted." "Then why did you not ask for it before?" "I didn't want to be a trouble. You seemed so busy, and I could manage to get along alone. You shall not want it any more, John." So this is the heart of what we're talking about in caring for people, even when it looks impossible for anything good to come out of it. I spoke at a caregiving conference, and they had as their theme, 90% of caring is just showing up. And I would say that that is actually true. Some people are more natural carers than others, but everybody can learn to do it. And everyone can find your own comfort zone and use the gifts you have. You need to have a little margin in your life, which means you can't write from the top to the bottom with all activities and everything and have the page all filled up with text. You have to have some margin there so that there's a place for you to have some time and some mental energy and to be able to go and help others and be with others. I am going to skip past Teague, who was an 11-year-old boy from BC with cerebral palsy, and he wrote about the Latimer case too back in the day. But I really like the last part of this. He says, "I can't walk or talk or feed myself, but I am not suffering from cerebral palsy. I use a wheelchair, but I am not confined to a wheelchair. I have pain, but I do not need to be put out of my misery. My body is not my enemy. It is that which allows me to enjoy Mozart, experience Shakespeare, savor a bouillabaisse feast, and cuddle my mom. Life is a precious gift. It belongs to the person to whom it was given, not to her parents nor to the state. Tracy's life was hers to make of it what she could. My life is going to be astounding." You gotta love his attitude. And he passed away 5 months later after he'd written that. So people are often asking me, and you can get this list if you send me an email, some things that you can do to help out. So this is the practical part of this. What can you do to make a difference in this? And there's a lot of things on here, wrapping presents and visiting and doing these kinds of things, helping people set up a Caring Bridge site or a meal website, that type of thing. One of the things that's been very helpful that patients have taught me, most of these things, patients and families, was to have someone who knows the family go to the family and interview them about what would be helpful. So do you need rides to lessons? Do you need meals? What's helpful? And then set up a sign-up book and figure out who is going to do that. Because everybody is really wanting to help. It's just one of those things where it's hard to know exactly. And if people say to the family, well, if there's ever anything we can do, they're not going to say, well, bring me dinner tomorrow. They're going to say, well, thank you very much. So it's very helpful to have that. The two pieces to that I think are important are to make it very specific, so that you say we want dinner on Tuesday, and to make it time limited. So say for the month of November, dinner's on Tuesday night for the month of November. And then the person can sign up again if he or she wants to, but it doesn't feel like you're signing up for Tuesday night for the next 10 years. One of the most spectacular things I ever saw done was a family that attended a small church, and the mother died at 32 and left 4 little children. And each of those children had a friend at church who was very close. And the families of those 4 of the children that were the friends, each of those 4 families sort of adopted the child for the next year to give that father time to get back on his feet. And they kept some clothes at the house. If they signed up for soccer, they signed up that child. If they went to a birthday party, that child went to the birthday party. If they bought school supplies, they bought for that child. And they didn't live with the families, but it just gave the dad the sense that his children were being cared for. There was a sense of normalcy, and it gave him a year to get back on his feet after he'd lost his wife. And I thought that was really wonderful that they had done that. And I don't know whether your children were anything like mine, but I had very active ones. And to be honest, it was almost easier to have somebody along, especially with my son that was his age, that could keep him busy than it was to just have him by himself. So I'm sure that it wasn't a huge hardship for the people to do that, especially since it was a special friend of one of their children. But boy, did it make a difference for that family. Don't be afraid to talk and to be there. people that have been in this situation will say, well, sometimes, yeah, people do say stupid things, but your silence is way worse than the mistakes that you make. And as long as you kind of keep watching, and if they have kind of a wince or something that doesn't sit right, apologize and say, oh, that sounded like it didn't come across very well. This is what I meant, or what was hard about that. Keep talking about it. The other thing that's really important in our day when families are really scattered is to think about what out-of-town family members can do to assist. So financial help, writing the story of the patient's life, compiling music that the patient loves. That can be a wonderful legacy, actually, for after the patient has gone as well. Reading stories or reading from the Bible in your own voice, and calling very often and speaking to the person who's the caregiver and not being judgmental about it. That can be really helpful. Sending gifts to both the caregiver and to the patient. One of the things that my dad absolutely loved was to get mail. He would check the mail over and over and over. And so my brother and I started sending him postcards. And after he passed away, we found a stack of postcards that was this high in his drawer. He kept every single one of them. And they were really helpful to my sister as well, because if he was really looking for the mail, she could stick one back in the mailbox and he would, it was the gift that kept on giving. So it worked out well. And we would only put a sentence on there. He couldn't really take in much more than that. So isn't this a beautiful picture of, I sent him a lot of pictures of Vancouver where he grew up. He was living with my sister elsewhere. And it looks beautiful today and that kind of thing. This is a picture of a stinging nettle. And who knows what happens when you brush up against this? It's bad. But there are a lot of people that think that nettles have some medicinal benefits from it. I'm not going to make any judgments about that. But one of the interesting things with this particular plant is that it has these little trichomes, and they've got a little cap on them, and they're like a hypodermic needle underneath. And if you brush it, it knocks those off, and it injects that poison that makes you sting and itch. But if you actually crush it, if you get in there and you grab it, then those trichomes are destroyed, and they're not able to inject the irritating chemicals. And so brushing up against it is worse than grabbing it. It's smarter probably to use gloves, but either way, it's still better. And one of the things is, I think this is a really fitting example of the difference between actually coming alongside people who are suffering or being back on the periphery and only brushing up against it. That when you brush up against it, all you get is that sting. You don't get any of the richness of having been there. Anyone who's been a hospice volunteer or someone who's worked with people, or even in your own life when you've been a caregiver, you know that there's a richness to it. Any parent that has had a really bad day with a toddler and then has the baby fall asleep in their arms with that little hand patting you on the back, it makes up for a lot. So, but just watching somebody with a toddler that's going berserk is worse almost than having one that's your own to love. And I think that that's one of the things. Now, the next few slides are going to come from my tradition as a Christian. And as I said before, I will, excuse me. I will trust you to make the translation to your own tradition. But it says, and now I will show you the most excellent way. So those of you who are Christians, where does that come from? It's not 1 Corinthians 13. You're close, though. 12. It's the last verse of 1 Corinthians 12. And then what comes after is all about love. And this part is, I think this part of 1 Corinthians 13 about love being patient and kind, it does not envy, it does not boast, it is not proud, it is not rude, it is not self-seeking, it is not easily angered, it keeps no record of wrongs. Love does not delight in evil, but rejoices with the truth. It always protects, always trusts, always hopes, always perseveres. Love never fails. That particular set of verses is something that people from all traditions embrace. And I think that this is what I hope we have from this day, that we think about having the more excellent way. One of my colleagues once said that rights are what we need when love has failed. That if love is there, and if everybody looked out for everyone else's interests as much as their own interests and really loved and cared, we wouldn't need rights. But it's a little bit like Winston Churchill saying democracy is the worst form of government, except for all the others. And that we do need rights because love does fail in our society. But what do we want to have as our bedrock? What do we want to have as our hallmark? For me, I want a society that has love, that never fails, that always protects, always hopes, always perseveres, always trusts. That's the kind of society I want to live in, one that has the imagination to care for people rather than to kill. One of my people that I really admire as a palliative care physician is a doctor named Sheila Cassidy, who wrote a book called Sharing the Darkness. She is a Catholic, and I'm not sure whether she's still practicing or even whether she's still alive, but she was the hospice director at the hospice in Plymouth in the UK. And she wrote this. She talked about a story from the Bible where it's identified as Mary, the sister of Martha and Lazarus, who had an alabaster jar of precious spikenard, which was a very precious perfume, and it was probably her dowry that she had. It was worth a lot of money. And she poured it over Jesus' feet and wiped it with her hair, and it was kind of her anointing him for his burial. And this is what Dr. Cassidy says about this. The most important message is the unspoken one to the world at large, that this dead loss to society, this dying woman or handicapped man, is infinitely precious. If I, as a doctor, spend an hour of my clinic time talking to a woman who has only a few weeks to live, I am making a clear statement of her worth. I am giving her time that could have been spent with people who will get better, who will be able to contribute once again to the common good. I am affirming the worth of one individual person in a world in which the individual is at risk of being submerged or valued for his strength, intellect, or beauty. It is a prophetic statement about the unique value of the human person, irrespective of age, social class, or productivity. It is an affirmation that people matter just because they are people, because God made them and loves them just the way they are, not because they are good or witty or physically beautiful. And she talks about how this extravagance of caring that we pour out on people in that situation is like the fragrance of that perfume that goes up before our culture to say these people are worth caring for. And so part of this is that creativity and imagination can help us concentrate on care, not killing, and that caring for each other is a really fundamental part of our Canadian identity. Our healthcare system, you put one finger on that healthcare system and you're political dead meat. And rightly so, because we think it's important to care for each other. We're willing to stand in line to care for each other. With 70% of us not having access to good palliative care, and with people with disabilities, many of them living below the poverty line, why are we thinking about making these drastic moves before all these other things are in place? If we even wanted to talk about it, we should at least wait until those things are in place. I say that it's like having someone who has a broken leg saying, well, we should just cut the leg off because we don't have good orthopedic surgeons available. We don't do those drastic things without having that available. And that's, I guess, what I'm asking for. The other thing that people sometimes wonder about is they say, well, palliative care, people will give medication and it hastens patients' deaths and all of those things. The literature actually shows that good palliative care can actually extend people's lives because they're not so anxious and stressed in their life that they're able to relax and to let their bodies do a little more healing. And so there were a couple of landmark studies that have been done recently that showed that good palliative care not only improved patients' quality of life, but improved the patient's quantity of life as well. So this is the quotation of Theo Bohr that Larry so eloquently talked about his conversation with him. and he's talking about don't go there. He was actually, Dr. Bohr, what Larry didn't tell you was that Dr. Bohr was a supporter of the legislation when it came in, and he felt that in his whole article, he says he thought that safeguards were possible. Now he feels that they're not possible after the time that he spent on the committee in the Netherlands. So these are my suggestions for action. Get yourself informed, and I suppose it's a little bit of what people would call preaching to the choir. If you came today, you're doing that. But send me an email and then look at some of these articles. Go to your own community, tell your stories, share what's compelling for you. Speak to the best in others. Don't just say, oh, well, you're so stupid to believe that. Speak to the best, because as I said before, people are worried about folks who are suffering, and that is why they're supporting this. They don't want to see people suffer. So how do we do that? How do we come alongside people? How do we help people and really care for them and not kill them? Become familiar with one or two of the papers that I've talked about. People respond when there is, like that Canadian Medical Association journal one where 1 in 3 was killed without any explicit request. So things like that, people say, whoa, that's something we're thinking about. Or the example of the twins in Belgium or something like that. And remember that you don't have to prove everything. You're just kind of like a witness for the defense. You're introducing that seed of doubt so that people will think about it. People talk about having an elevator speech. So what is it when you're riding up in the elevator and somebody says, I saw you on TV, and why are you opposed to euthanasia anyway? That you've got, an elevator rides versus a speech which about 1 to 2 minutes. Memorize it and stay on topic. Don't go all over the place, but have a cogent reason that it makes sense to you why you're opposed to it. Or if you're here and you're in favor of it, have cogent reasons why you're in favor of it. Just have it down. It's a little easier to do sound bites if you're in favor of this, because choice always sounds good on the surface, and all the things that we're